Hi, I'm Dr. Josh here with Live Your Life Integrated Health and Chiropractic. Today we're going to be talking a little bit about the SI joint. The SI joint is the sacroiliac joint, for those of you who don't know that. It's essentially where the sacrum joins up with the hips here. So you have two sides on the back. You have the left and the right. As you're walking, there's a lot of movement occurring there at the SI joints. And you also have the front side here. And this is typically where we see a lot of these injuries occurring with the SI joint. Now the SI joint's force, its goal is to transition forces from the upper body to the lower body and from the lower body up through the upper body. So it's the key foundation here to the spine. And it's supported by ligaments. Now the thing about ligaments is that because they have very poor blood circulation, they heal very slow. And so anytime you do something like overstretching, like a lunge, or you are stepping weird, you miss a step, those types of things, even with pregnancy, we see a lot of times due to the relaxin, the hormone that causes excess stretching within those ligaments, we see that ligament getting stretched too far that's supporting that SI joint. And when that happens, you have what they call the ligamental muscular reflex. That's not important, but essentially the muscles will contract to try to guard you from stretching that out even more. And the key part to this is that as those muscles start to get tight, you start to notice those muscle tightness patterns being the main source of your pain, the main cause of your dysfunction. But because it's an overstretching of the ligament that's causing this, we really want to focus on supporting that ligament and finding a good way of stabilizing it. So rather than trying to do things to stabilize, it's more important to avoid things that can cause excess stretching. Things like lunging, doing a very deep lunge where you're putting a lot of stretch into that SI joint there. Doing things like even crossing the leg across midline, you're putting excess stretch on the backside of that SI joint. Recumbent bicycling, where you're really getting a lot of extension on the leg. Those are all things to try to avoid. Additionally, in the office, when we see that an SI joint sprain is likely, we'll use something called an SI joint belt. Now the belt looks like this. It's very inelastic on the initial side to it. You wrap it around the SI joints, get it really, really tight, and then you have this elastic portion here. You add a little extra stretch. Now what this is doing is it's acting as an external ligament. It's essentially wrapping around and supporting those SI joints and providing that stability that's unable to be provided when those ligaments are stretched out. Okay, let's loosen this here and take this off. Now on top of this, because like I was saying with the poor blood circulation to the ligaments, you can typically expect around 6 to 10 weeks before that ligament will fully heal. So it's a very slow process of getting things back to stabilization. To do this, you're going to have a lot of muscle tightness, like I said, and all of that is going to be the main cause of your pain. So in the office, we'll do a lot to relax those muscles, but it's important to not try to stretch those out, because as you try to stretch out those muscle tightness patterns, you're going to be stretching those ligaments as well, which is counterproductive to the healing of it. So all of these tips will be provided at the office, but the goal here is that we provide some stability to the main key here of your spine, to the pelvis and to the hips. Thank you.